we're moving now on to our second segment, and the gist of this story. We're looking at cyber attacks on healthcare, an Islamic perspective on ethical and social implications. So a ransomware attack by the Russian group Curran on Synovis, a private pathology firm serving major London NHS hospitals, led to the cancellation of nearly 1,600 operations and outpatient appointments. The attack involved encrypting files to extort payment, resulted in the leakage of sensitive patient data, and caused significant disruption to healthcare services, particularly affecting the vulnerable patients awaiting critical surgeries. By examining these issues and this show, we will illuminate how Islamic values can guide ethical behavior and community protection in the digital age. And to get more on this news, we are joined by our first guest. We are joined by Professor Curran, he is a professor of cybersecurity, executive co-director of the Legal Innovation Center at Ulster University, and he is also one of the most interviewed technology experts in the UK, with over 2,000 interviews in recent history. Thank you so much for joining us this morning and sharing your expertise with us. Thank you, Professor.
You're welcome.
I wanted to ask you, can you firstly please explain the significance of cybersecurity when it comes to the healthcare industry, please?
Yeah, I mean, I guess the healthcare organizations are a little different than some other industries that we deal with, due to the sensitive nature of our patient information. And again, and of course, because of healthcare being crucial, to life survival, it just makes such a difference. And again, unfortunately, it's employees opening malicious emails, which is the main source again for ransomware attacks, which is the most prevalent attack that we see. Again, that's where all the information is encrypted and things cannot happen that you can't access files again. So, just anecdotally, my cousin worked in the healthcare system in the south of Ireland, which had one of the biggest cyber attacks in Europe there, which is almost now 2 years ago. And she remembers clearly having to rely on pen and paper back then. And she also remembers consultants being very angry in the first stage of the attack, because they couldn't believe that they had to leave their computers and walk down to the X-ray department and physically do what people have been doing many years before computers came along. That was really annoying for consultants, because they become so used to the X-rays being sent all the way to the computers at their desk in their particular department again. So that slowed down things, of course. That causes a backlog, and things are not as efficient. And even simple things, when the ransomware attack hit the hospitals again, but they hadn't stickers, and because on every page of the patient's notes, you have to place a sticker and write the name and the date of birth and their PCN number, which is their unique identifier. That had to be done by hand. And what is kind of also scary as well, that ordinary people may not be aware of, but when you're in an emergency or when you're being rushed to hospital, the ambulance will ring ahead with the patient's details again, so that when the patient pulls up at any hospital again, that they're able to see, everything irrelevant about that patient. But when the ransomware attack happened in the south, they had none of that. They were literally working in the blind, in the dark, whenever a patient pulled up at the hospital, because they could not access the critical information for patients again. So just things like this, these things are critical. IT systems have become the heart of modern hospitals and healthcare organizations again. So when something happens in that arena again, you can just see in the examples I've given how the effects are on patient health, and yeah.
Absolutely. Thank you so much for that, Professor Kevin. What do you think could be some of the causes for this cyber attack?
Again, so the main attacks that are happening are ransomware. Again, so this is where the hospital systems are encrypted their information again, and was just a recent paper I was reading there, came out from the United States about where they looked at the link between ransomware attacks in hospitals again, and what they found was volume decreased by between 17 to 25% during the initial attack week. And also, again, that it did increase in hospital mortality for patients who were already admitted. So ransomware has led to increased mortality again. So people do die, actually, because of lack of information, lack of IT infrastructure as well. And that's very, very serious, of course. And of course, ransomware is done generally from Eastern Europe. Again, and it's done with the role of being able to solicit money from hospitals and from all types of organizations. And there was a moratorium on on hospital attacks again, because a lot of the malware that is used for ransomware attacks, you rent it out as such. You literally rent it from some of the top hacking groups. And that after the NHS and others were attacked, and also in America, that the actual people who created this terrible software, they actually said that you can't use it against hospitals. And they seemed to kind of obey that kind of self-imposed rule for about a few months, but now it's kind of gone back again. So there is, again, no moratorium on attacking NHS hospitals worldwide, of course, outside their native countries, again, that the Russian ransomware groups, for instance, will not dare attack anything within Russia, but they're given carte blanche to attack, anywhere in the West.
Thank you for that. And when it comes to cyber threats as well, can you explain what are some of most common when it comes to the healthcare sector?
Again, so that would be, again, the ransomware that we talked about, and of course phishing attacks, which are emailed again, which are sent again, trying to target employees to get patient records, login credentials, or financial information. And then we have malware, of course, and the data breaches, and of course insider threats as well. So again, it's a range of things really, but again, it comes down to really money for hackers in the end. And of course, unfortunately, hospitals are, because they're so large, and they've been around for so long, and they have such a wide range in capabilities with equipment like IoT devices and heart rate monitors, and a lot of these devices that they run quite old, that they just haven't been maintained, that they run quite old versions of Windows, for instance, like Windows 95. And of course, as we know, that each year Windows 95 and 98 and all these other ones, which are not serviced anymore by Microsoft, they get weaker and weaker as more vulnerabilities are found in the modern version of Windows 11, for instance, because every month on Patch Tuesday, as we say, the second Tuesday of every month, Microsoft release a list for IT administrators around the world, showing all the flaws that have been found, where the majority of them are security. And what the hacking groups do, the state-sponsored ones especially, they look at the latest release of fixes every second Tuesday of the month, and they go to themselves, I wonder, is that flaw that Microsoft have just fixed, I wonder, is that flaw also available in Windows 95 and 98, for instance? And these are the operating systems which are used in a lot